So Shire's role in the supercluster is really a rare disease focus. Shire Human Genetic Therapies is part of a specialty pharmaceutical company, and our division focuses exclusively on very rare diseases, primarily genetic disorders. We feel that it's an underserved market. We feel that there's a high unmet medical need, and there's something that we can actually contribute to by adding value to the healthcare system by helping these patients with very rare diseases lead better lives.
Really, I think it's a combination of two things. One is we have the opportunity to make an extraordinary difference in the lives of patients, and it's hard to imagine any job where you could get out of bed every morning with that opportunity. And the second thing is I lead a group of about 700 highly committed, very capable folks, and to see that group deliver on our mission is just extraordinarily fulfilling.
I think things like the amount of funding that NIH delivers to Boston-based hospital systems, Massachusetts-based hospital systems, one, it's a clear demonstration of the success that the industry has. The other benefit is certainly to patients. The institutions here can deliver cutting-edge science to patients through clinical trials, early involvement in testing of new therapies. All that matches up with the great basic health care that's provided here. Again, very potent package.
Being close to the world-class Boston and Cambridge facilities is a real benefit for Sanofi. It allows us not only to see and stay in contact with today's clinicians that are working on the products that were developed years ago, but most importantly, it allows us to work with some of the top research minds in the world for the development of future compounds, but also in the network of other community hospitals and also group practices around in Eastern Massachusetts that gives us a very rich, vibrant, and diverse patient population.
When we start a company, we make a wish list of who are the very top people in the world that are working in that field. And many times, several of the names on that wish list actually are in Massachusetts. So that's very helpful. And I think that other researchers are happy to come here and work with us as well.
There's a seriousness of purpose when it comes to medical research discoveries and the care of patients. And we recognize that we have a responsibility to reach out to patients, to create that new and perhaps enabling transformational idea in medicine that might come up with a therapeutic that would make things different. One thing that's so special about Massachusetts is that we blend a rich history, we bring new ideas, and we do it in a collaborative manner that really is exponential, if you will, in its end result.
I have been in this field for a long time, at this point at least 40 years. I have never lost my enthusiasm for the fact that this is a group of sectors where you have a chance to, as they say, do well and do good. I appreciate the important economic impact because we're in a tough economy right now. But I think most importantly, it's a chance to make a difference.
People will always have healthcare needs, and the needs in many ways are greater than ever. Those solutions, to a large extent, will come from the biopharmaceutical industry. And again, that puts you back in Massachusetts. I think personally, or in terms of Genzyme specifically, as a Sanofi company, I think we're very well positioned to play a very significant role in solving some of those very important unmet medical needs.
What we have here is an opportunity at Cerulean to change that, to really change it in a profound way. What I see happening here is that we can have cancer therapies that are well tolerated for patients while improving their duration of life. So often there's a trade-off between you can make somebody live longer, but at a horrible cost, horrible side effects, and really, really low quality of life. What we aspire to do is to actually improve the length of life while at the same time improving the quality of life. And that's just not been done before. There's always been that trade-off. And I think that's motivating for everybody in the company. You don't get an opportunity like that too often, and that's what we're working on.
I think that's, again, is what's so compelling about this area, that people can see from the initial conception all the way through to that individual patient who has benefited from a product that's been discovered, manufactured, and sold here.
Biotech research, it's clearly very important. You know, for me as someone with MS, I mean, I would like a cure. I would like them to find a therapy that can fix some of the damage that's already done. You know, my spinal cord and my brain is full of scars. Nobody's figured out how to repair them yet, but you know, they're working on it. A myelin repair is something that they're definitely working on as we speak.